the Majority Leader's office for 6 weeks. It's only been on the floor of the Senate for 3 days. I think it's clearly not the case that the Republicans want to delay a process that we've only now gotten an opportunity to participate in, since this has been a strictly partisan venture from the beginning. But we'll have an opportunity over a number of weeks to offer amendments. We're going to have 4 votes today, and hopefully we can proceed at a more rapid pace than we got off to the first couple of days. And of course, the reason we didn't have 2 votes last night was because there were objections on that side of the aisle. But hopefully we're now into a process where we can go forward without the kind of delay that we had generated by both sides over the last couple of days. Yesterday, some of our friends on the other side were at great pains to explain one of the core pieces of their health care plan. I'm referring, of course, to the massive cuts in Medicare they plan to make as a way of expanding government's reach even further into the lives, more specifically into the medical care of every American. I have no doubt that our friends were reluctant to call for these cuts. But in the middle of a recession, and at a time when more than 1 in 10 working Americans is looking for work, it isn't easy to find $500 billion lying around. They had to find the money somewhere, and so they set their sights on Medicare. Republicans have been entirely consistent in this debate. Medicare is already in trouble. Already in trouble. The program needs to be fixed, not raided to create another new government program. We fought these senseless cuts from the outset and will continue to fight them. Democrats, meanwhile, have taken a novel approach, a truly novel approach. They have apparently decided there's no way to defend these Medicare cuts, so they simply deny they're doing it. They can't defend the cuts, so they deny they're doing it. It hardly passes the smell test. Here are the facts. According to this bill, this is a fact, Madam President, Medicare Advantage is cut by $120 billion. Madam President, it is a fact that hospitals that treat Medicare patients are cut by $135 billion. Madam President, it is a fact that home health care is cut by more than $42 billion. Nursing homes are cut by $15 billion, and hospice is cut by $7.6 billion. These are the cuts that our friends on the other side claim not to be cuts. They're cuts they claim not to be cuts. This is the plan that our friends on the other side say will, quote, save Medicare, end quote. A talking point so plainly and completely contradicted by the facts, it's almost impossible to repeat it with a straight face. I mean, cannot be repeated with a straight face. One Democrat took this strategy to a new level yesterday when he declared on the floor that it wasn't even accurate to describe cuts to Medicare Advantage as cuts because Medicare Advantage, he said, is not a Medicare program. That was said right here on the floor of the Senate, Madam President, just yesterday, that Medicare Advantage was not a Medicare program. Well, that's apparently news to the Department of Health and Human Services, which states on its website, it's the Department of Health and Human Services, on its website, in words as plain as the alphabet, quote, Medicare Advantage plans are part of the Medicare program. According to the Department of Health and Human Services, Medicare Advantage plans are part of the Medicare program. And it's news to the millions of American seniors who depend on this popular program for their care. At the moment, Medicare Advantage has nearly 11 million enrollees. Looking at it another way, that is 1/4 of all Medicare beneficiaries. 1/4 of Medicare beneficiaries are on Medicare Advantage. And in recent years, this program has proven to be particularly popular with seniors in rural areas who would otherwise have limited access to care. Seniors have shown that they want this plan. They like it. And I dare say that if you had asked seniors earlier this year what they expected health care reform would look like, It certainly wouldn't have involved massive cuts to a program that they've shown they like and they want. Medicare Advantage has also been proven to help in a particular way low-income and minority seniors. That's one of the reasons minorities are more likely to enroll in it than others. So this program has given a boost to historically disadvantaged populations and given them a greater measure of dignity toward the end of their lives. Now, these cuts are bad enough, but despite what our friends have said, the Democrat plan for Medicare Advantage doesn't stop here, because their bill also gives the Medicare Commission, explicit new authority to cut even more from this popular program in the years ahead. The president has repeatedly said that people who like the plans they have will be able to keep them under his plan. He said people currently signed up for Medicare Advantage will have the same level of benefits under his plan. Well, common sense, Madam President, common sense tells us that you can't cut $120 billion from a benefits program without affecting benefits. How in the world can you take $120 billion out of a benefit program and not affect benefits? And the Independent Congressional Budget Office confirms what common sense already tells us. And they actually quantify it. CBO says the bill we're debating will cut extra benefits that seniors receive through Medicare Advantage by more than half. That's CBO. The fact is, cuts to Medicare Advantage are cuts to Medicare. And if it's true of Medicare Advantage, it's true of other Medicare cuts in this bill. Democrats can deny these cuts all they want. America's seniors aren't buying it. Now, later this afternoon, Madam President, we're going to have a Bennett amendment, Bennett of Colorado, as a side-by-side to Senator McCain's amendment, which would send back to committee the Medicare cuts in this bill and ask the committee to report it back without them. And so I want to comment briefly on the Bennett amendment, and we're going to have more to say about that during the course of today's debate. This amendment is a shell game designed to hide the $500 billion in cuts that I've just been talking about. The Bennett of Colorado amendment is a shell game designed to hide the $500 billion in cuts that I've just described. If the Bennett amendment passes, the bill will still cut $500 billion from Medicare. Let me say that again. If the Bennett of Colorado amendment passes, the bill will still cut $500 billion from Medicare. It does not protect Medicare. There's only one way to protect Medicare, and that is to support the McCain amendment. Madam President, I yield the floor.
President, would the senator yield for a question?
I'd be happy to yield to the senator from New Hampshire.
I wanted to ask the senator a question. First, the senator is absolutely right to point out that the Bennett amendment is a shell game, a charade, and a farce.